central nervous system. The central nervous system, or the CNS, is a processing center for the nervous system. It receives information from and sends information to the peripheral nervous system. The two main organs of the CNS are the brain and spinal cord. The brain processes and interprets sensory information sent from the spinal cord. Both the brain and spinal cord are protected by three layers of connective tissue called the meninges. Neurons. Neurons are the basic unit of the nervous system. All cells of the nervous system are comprised of neurons. Neurons contain nerve processes, which are finger-like projections that extend from the nerve cell body. The nerve processes consist of axons and dendrites, which are able to conduct and transmit signals. Axons typically carry signals away from the cell body. They are long nerve processes that may branch out to convey signals to various areas. Dendrites typically carry signals toward the cell body. They are usually more numerous, shorter, and more branched than axons. Neurotransmitters. Neurotransmitters are endogenous chemicals that transmit signals from a neuron to a target cell across a synapse. Neurotransmitters also are packaged into synaptic vesicles clustered beneath the membrane in the axon terminal on the presynaptic side of synapse.
Children are at greater risk for complication after anesthesia. Laryngospasm, bronchospasm, aspiration, and even death may occur. They require very careful monitoring and support, and the anesthetist needs to be very skilled at calculating dosage and balance during the procedure. Adults require a considerable amount of teaching and support when receiving anesthetics, including what will happen, what they will feel, how it will feel when they recover, and the approximate time to recovery. Older patients are more likely to experience the adverse effects associated with these drugs, including CNS, cardiovascular, and their dermatological effects. Use of antidepressant drugs with children poses a challenge. The response of the child to the drug may be unpredictable, and the long-term effects of many of these agents are not clearly understood. Studies have not shown efficacy in using these drugs to treat depression in children, and also indicate that there may be an increase of suicidal ideation and suicidal behavior when antidepressants are used to treat depression in children. Adults using these drugs should have medical causes for their depression ruled out before therapy is begun. Thyroid disease, hormonal imbalance, and cardiovascular disorders can all lead to the signs and symptoms of depression. The patient needs to understand that the effects of drug therapy may not be seen for 4 weeks, and that is important to continue the therapy for at least that long. Older patients may be more susceptible to the adverse effects of these drugs, from unanticipated central nervous system to increased sedation, dizziness, and even hallucinations. Doses of all of these drugs need to be reduced and the patient monitored very closely for toxic effects. Safety measures should be provided if CNS effects do occur. The adverse effects of TCAs are associated with the effects of the drugs on the central and peripheral nervous system. Sedation, sleep disturbance, fatigue, hallucination, disorientation, visual disturbance, difficulty in concentrating, weakness, ataxia, and tremors may occur. Use of TCAs may lead to GI anticholinergic effects such as dry mouth, constipation, nausea, vomiting, anorexia, increased salivation, cramps, and diarrhea. Resultant GU effects may include urinary retention and hesitancy, loss of libido, and changes in sexual functioning. CV effects such as orthostatic hypotension, hypertension, arrhythmias, myocardial infarction, angina, palpitation, and stroke may also pose problems. Miscellaneous reported effects include alopecia, weight gain or loss, flushing, chills, and nasal congestion. These adverse effects may be intolerable to some patients who then stop taking the particular TCA. Abrupt cessation of all TCAs causes a withdrawal syndrome characterized by nausea, headache, vertigo, malaise, and nightmares. The safety and effectiveness of most of these drugs has not been established in children. The incidence of Parkinson's disease in children is very small. Children do, however, experience Parkinsonian symptoms as a result of drug effects. The eventual dependence and lack of control that accompany Parkinson's disease are devastating to all patients and their families, but may be particularly overwhelming to individuals in their prime of life who value a high degree of autonomy, self-determination, and independence. Although Parkinson's disease may affect individuals of many age, gender, and nationality, the frequency of disease increases with age. This debilitating condition, which affects more men than women, may be one of many chronic problems associated with aging. The adverse effects associated with the antipsychotic drugs are related to their dopamine-blocking, anticholinergic, antihistamine, and alpha-adrenergic activities. The most common CNS effects are sedation, weakness, tremor, drowsiness, extrapyramidal side effects, pseudo-Parkinsonism, dystonia, akathisia, tardive dyskinesia, and potentially irreversible neuroleptic malignant syndrome. Anticholinergic effects include dry mouth, nasal congestion, flushing, constipation, urinary retention, impotence, glaucoma, blurred vision, and photophobia. Cardiovascular effects, which are probably related to the dopamine-blocking effects, include hypotension, orthostatic hypotension, cardiac arrhythmias, congestive heart failure, and pulmonary edema. Anti-epileptic drugs can have an impact on a child's learning and social development. Children may also be more sensitive to the sedating effects of some of these drugs. Children should be monitored very closely and often require a switch to a different agent or dosage adjustments based on their response. Adults using these drugs should be under regular care and should be monitored regularly for adverse effects. They should be encouraged to carry or wear a medical identification to alert emergency personnel that anti-epileptic drugs are being taken. Adults also need education and support to deal with the old stigma of seizures, as well as the lifestyle changes and drug effects that they may need to cope with. Older patients may be more susceptible to the adverse effects of these drugs. Dosages of all these drugs may need to be reduced, and the patient should be monitored very closely for toxic effects and to provide safety measures if central nervous system effects do occur. The adverse effects associated with these drugs are related to the CNS stimulation they cause. CNS effects can include nervousness, insomnia, dizziness, headache, blurred vision, and difficulty with accommodation. GI effects such as anorexia, nausea, and weight loss may occur. CV effects can include hypertension, arrhythmias, and angina. Skin rashes are more common reaction to some of these drugs. Physical and physiological dependence may also develop. Because CNS stimulants have this effect, the drugs are controlled substance. The safety and effectiveness of most of these drugs have not been established in children. Adults being treated for acute musculoskeletal pain should be cautioned to avoid driving and to take safety precautions against injury because of the related CNS effects, including dizziness and drowsiness. Older patients are more likely to experience the adverse effects associated with these drugs, like CNS, gastrointestinal, and cardiovascular. Because older patients often also have renal or hepatic impairment, they are also more likely to have toxic levels of the drug related to change in metabolism and excretion. The safety and effectiveness of many of these drugs have not been established in children. If a narcotic is used, the dose should be calculated very carefully and the child should be monitored closely for the adverse reaction associated with narcotic use. Adults being treated for acute pain should be reassured that the risk of addiction to a narcotic during treatment is remote. They should be encouraged to ask for pain medication before the pain is acute to get better coverage for their pain. Elderly patients should be specifically asked whether they require pain medication, because many older patients can recall a time when nurses were able to spend more time with patients. They may tend to believe that the nurse will meet their needs. Older patients are more likely to experience the adverse effects associated with these drugs, including central nervous system, gastrointestinal, and cardiovascular effects. Because older patients often have renal or hepatic impairment, they are also more likely to have toxic levels of the drug regulated to change in metabolism and excretion. The older patient should have safety measures in effect, like side rails, call light, assistance to ambulate when receiving one of these drugs in the hospital setting.